Hello lovelies, welcome back to my channel and welcome back to another video. We are still with the conditions in the pregnancy. So today we are going to look at malaria in pregnancy. So stay glued to your seat as I take you through the signs and symptoms, the effects on the mother and then the fetus, and then the preventive measures as well. So if today is your first time seeing this face, I'm Janetta Osua, your community health nurse Papa, and this channel is about health education for kids and adults. If you haven't subscribed yet, kindly subscribe to this channel and be part of this beautiful family. Also like, share, comment down below at the comment section. In my previous video, I talked about pregnancy-induced hypertension. So we'll leave the link down below at the description box so you can go check it out. So by the end of today's video, you'll be able to understand malaria in pregnancy and the needs of preventing it, okay? Alright, so we will first look at what malaria is. When we talk about malaria, malaria is an acute infection or human disease that's caused by Plasmodium parasites in the red blood cells. And this parasite is transmitted by female Anopheles mosquito, and it is characterized by periodic attack of chills and then fever. Alright, so let's look at the signs and then the symptoms of malaria. We have chills, we have fatigue, we can get fever, night sweats, shivering, nausea, vomiting, headache, and then fast heart rate. So these are the signs and symptoms of malaria. Then let's see what are the effects of malaria in pregnancy. We have to the mother and then to the growing fetus as well. So first of all, let's look at for the mother, the effects on malaria in pregnancy. Okay, so the first one, we have maternal anemia. So you can get maternal anemia out of this malaria in pregnancy, and you can even have a low birth weight at the end of it. And then you can also have hypoglycemia, and then hypoglycemia is having a low blood sugar level. And also you can get spontaneous abortion, that is the loss of pregnancy. You can get pregnant and then you can get loss of the pregnancy. So let's see the effect on the fetus, the baby growing inside you. Let's look at what can also happen to the baby. If you have malaria in pregnancy, the fetus growing inside you, we can have a fetal loss. So we can lose the baby. And then premature delivery. You can born before your time. Okay, so this pregnancy, malaria in pregnancy, it's a very dangerous conditions in pregnancy. All right, so the other things are intrauterine fetal death. That is what we call the IUFD or stillbirth, and that is the baby that dies in the womb after 20 have the pregnancy. All right, and due to this malaria in pregnancy, you can lose the baby inside the womb, and you can imagine. So this is very bad condition that we don't have to play with, okay? And then we have growth retardation of the baby. You see that the baby is not growing as the baby is supposed to grow. Then delivery of a low birth weight infant. Yes, so this too can be a cause or effect to the baby as well. So let's see how we can prevent this malaria during pregnancy. So first of all, pregnant women should sleep under insecticide treated net. That is the mosquito net we give. That is why when you are pregnant and you go to the hospital, on your first visit, we give you mosquito nets that you can sleep in, and it will help prevent mosquito bite, okay? And then the second point is to avoid a mosquito bite using an insect repellent. So you can use a repellent when maybe you are outside or even inside and stuff. All right, so all stagnant water near houses should be drained, okay? So if you've seen some water that is stacked around your house, kindly drain it. So the other things that we can also do to help prevent malaria during pregnancy is that all rubbish should be buried or put in a bin with a lid, and then it will help prevent mosquito breathing. Okay, and then pregnant women should also comply with the prophylaxis schedule. You see, when you are pregnant after 16 weeks or after quickening, like after you feel the movement of the baby, we start to give you SP. That is what we call the sulfadosine pyrimethamine, and with that you do a GCSPD, and if you have no defect you can take it, and this also helps prevent malaria. So those of us, that's when we go, we will say that I haven't eaten, because you know you have to eat and it's a dot, and then take it right in front of your midwife, then they will be saying that mindidi, meaning they just don't want to take. But I know with my midwives at work will tell you go and eat and then you come and take it, because they are all helping. We prevent malaria in pregnancy. Okay, so the other thing is that pregnant women, you can spray your rooms with an insecticide spray to kill all mosquitoes if there are any available. And also, if you have water in containers, you are to cover it. So you also have to cover water containers at home. Okay, maybe you fetch some water down, you have to cover it so that the mosquitoes won't come to breed there. And then lastly, you have to wear bright colored dresses at night to prevent mosquito. So to prevent mosquito bites. Okay, so all these preventive measures that I have said can be done by an individual, not only my pregnant women, with the exception of the prophylaxis that we give to the pregnant women, of which if you are not pregnant you can't take that one. So other methods that I have mentioned, all of us can apply it, and then it will help us prevent malaria. Okay, and then to my pregnant women, also help prevent malaria in pregnancy. All right, so I believe that we have all learned something new today. So we'll end here for today's video, and you can leave your comments down below at the comment section, and also give this video a thumbs up if it is useful. Also like and share this video, and kindly subscribe to this channel if you haven't subscribed, and be part of this beautiful family. Also hit the post notification bell, so anytime I upload a video you'll be the first to get it. Okay, so bye for now, and then see you again in my next video.